Morning.
Good morning. Steve, the waiting room is still clearing out. We've got several people. I think I see Brandon coming in.
There's Brandon and Casey.
Good morning.
Hey, Brandon. Angela, right?
I'm here.
Hey, how are you?
How are you?
Whoa, look at that. Hey, Aaron, what's your count?
I have you, Brandon, Angela, and Casey. So I have four. Every time I try to scroll, we get more people in the waiting room. So when they come in big groups sometimes. So if I missed anybody, let me know. I think that's all we currently have. Kelly, do you mind to just resend the new link out to the TAC members just to make sure they got it? I hate to bombard their emails this morning, but I do again apologize to everybody for the Zoom mishap. So it's,
Sure,
that's why I always thank you. That's why I always log in 30, 45 minutes before a meeting and try to test it.
I understand. I know there's General Assembly stuff happening. I think there's a 988 press conference as well this morning. That may be distracted or
Okay.
read right now.
Okay. Well, I can keep an eye out and let you know if anyone else joins.
Okay. So we have four members, so we don't have a quorum, so we can't take action on the minutes. But I'm here. Brandon Harley is here. Casey Mihalovic, how was that?
Close enough.
Okay, there's a C in there, isn't there? And Angela Darcy from AOC. All right, appreciate y'all being here. DMS update.
Good morning. Angela Sparrow again, Behavioral Health Supervisor. Leslie was not able to join this morning, or I don't see her on. She was, again, not going to be able to, expected to make it. So wanted to give you some updates again in terms of the reentry 1115 application to CMS. So we did receive some initial questions from CMS in the last couple of weeks. Again, this was just kind of their first look over of the application. There was really nothing outstanding or alarming in the questions. Really, they were just mostly clarification asked to the state what was included, what was already included in the application. So we did go ahead and send written responses to them, and we're working on scheduling a call to review those, hopefully here at the end of the month or 1st of April, just to, again, go over those. But again, there's expected to be more to follow. That was just from their first look over. And again, from this point moving forward, this kind of begins the negotiation phase with CMS in terms of the application.
But those initial questions weren't concerning. They were kind of typical, or other situations you've seen similar questions.
Yeah. Yeah.
No.
Again, it was information that was included in the application, just them clarifying our ask or our statements. And so it was nothing too alarming. But again, we certainly expect more. They may have more questions for us when we schedule the next call. But they again did not have their subject matter experts available for our routine 11:15 call. And so again, more to come there, but which is promising that we're starting to have conversations. So that's a good thing. I do think one other state, and I apologize, I'm gonna have to take a look. I'm not sure if it was Minnesota. I believe one other state was approved in the last couple weeks for our re-entry demonstration. And so again, taking a look, we'll be looking at that state and their request. Just to be aware, what their ask is. And that's also just a reminder, I think to all the individuals that, again, other states have been approved, but it does not mean that other states are implementing yet. So still no other states are in that stage. So Kentucky, again, with our ask, it was more specific, more narrow, again, in terms of hopefully being able to get a more timely approval and move forward. So again, that doesn't mean that we potentially could not be approved and implementing before some of these other states as well. So we
Is there a
did.
clock? Is there a time frame, or are we just nothing?
No,
official yet? Okay.
Yeah, not in terms of the 11:15 demonstrations. It's different than a SPA, the state plan amendment, where there's a kind of a clock set. So really there's not. And we again did have some conversation. NASHP again is the National Academy for State Health Policy. They reached out to Kentucky, and our partners were also involved in the conversation. They wanted to gather some information regarding the work that we've done across the state in terms of reentry. And so again, we've been invited next week to participate. It's going to be a cross-agency partnership, and again, the collaborative or this learning series is to improve health and success of individuals with correction systems. And again, there's going to be a two-part. One part is focused more on the state health policy makers. And then again, there will be a separate series for more of the justice involved folks. But so we were asked to speak to that next week. And so again, Leslie will be on that call. They're interested to hear about our partnerships and our collaborations and the work that we've already done. So she's going to speak to that a little bit, but just wanted to let you know that we were invited to participate in that. And again, that specific call will just be for state Medicaid agencies. I think again, I do want to mention, some of you probably hopefully did receive an email notification about the ACRES Advisory Council or that committee again. So I think the end of the week, hopefully you'll receive the actual invitation, but we did go ahead and set a time frame for that. The kickoff will be April 17th at 11 a.m., 11 to 12:30 a.m. That initial meeting will really be just recapping what the ask is about the process. And again, kind of the next steps, what that advisory council role will be. And so that will be kind of the initial kickoff and overview for that.
Thanks, Angie.
You're welcome. Any other questions?
Yeah, last month we just had a good presentation discussion around Hep C with folks from UK. Any further discussions with them you want to update us on?
Haven't. Again, we did make the contact and reach out. I think again, the intent is through the planning, implementation planning process to discuss how we can address and again, be able to assist in access to those services. Again, I think it's going to initially need to be a braided funding and effort to do that. And then as we move along in the demonstration, again, can request additional coverage for specific services.
There's a question.
And, oh, go
Should
ahead, sorry.
MCOs receive the kickoff?
Yes, Stephanie, there were a couple, we're following up on that for a couple of the MCOs that designated some individuals. We received some kickbacks in their emails. And so
Okay.
Myers. Oh,
Okay,
sorry.
yeah, I saw this
Myers.
for the 17th, but I hadn't seen the invite come through. So when you had given
Oh.
a time, I was concerned because I hadn't had it on my calendar.
Oh,
Okay, thank you.
No, the actual invite should come out here in the end of the week. So we just narrowed down the time yesterday, and it will be virtual. It'll be a virtual meeting. So, so again, any other questions in terms of that?
No, I do not. Anyone else have questions? We're just looking forward to getting busy.
I agree. I agree.
It's House Bill 6 on the agenda because there's some language. I'm just kind of confused what this, I mean, I'm assuming it's this. Well, where was it? But there were several waivers included in the budget bill, and I haven't really gone into a deep dive on the Senate side. Oh, it has an incarceration waiver. That would be this waiver piece.
It is. It is still, again, the funding does match up to the request for the reentry. So we again have tried to explain that that again the incarceration is now the reentry, but the funding does align to what was requested. So yes, it is the reentry. The official request to CMS,
incarceration at one time.
yeah, the demonstration opportunity is reentry. So
Okay.
that is.
Yeah, and that looks like it's about 36, almost $37 million a year. Does that sound right?
It does. Yes, that was calculated in budget neutrality calculations. Yes.
All right.
So,
Good deal. Just want to make sure.
yep.
Anybody have any other questions?
I do think there was some question maybe in the Senate if there were some services that maybe were left out. So I think that's still being looked into. It's still being monitored.
Yeah, my initial review of that, some of the waiver slots were reduced for sure in the Senate. I don't know. I haven't had a chance to go into deep dive.
So I think again, it's just important to continue to advocate in the importance of the services. I think again that Medicaid, obviously we have been working on these services for quite some time, and long before legislation asked us to submit requests. And so again, that's, I think it's important to remember that we do have legislation that does ask us to and require us to submit request to CMS, but in order to do that and move forward with that, we also need the funding to support it. So it's a
The
twofold.
mobile crisis funds were probably a big shocker.
Yeah.
For those who on the call, there was money in the governor's budget for mobile crisis, both in the Medicaid administration budget, the Medicaid benefit budget, and actually the Department of Behavioral Health budget had some state general fund for that as well. And that was all taken out in the House. And it doesn't look like the Senate put it back. So that's obviously concerning. So that
It-
process is starting planning now, right?
Right, right. So,
Maybe, hopefully by April 15th, we get it all figured out, right?
right.
All right, appreciate it. Any other questions? All right, we're moving. That's okay. MCO updates? Etna?
Hi, this is
What?
Lana. Was somebody else gonna talk? Okay,
This is
sorry.
Stacy Alana.
Oh, okay. Did you want to talk?
I was just gonna say I don't have any updates on my end, but if you have any, go ahead and mention those.
Okay. We went to a community impact meeting. We've gone to a reentry simulation. I've also gone into Ohio County and worked with drug court and went to an expungement clinic in Lexington. And we have some upcoming events that we're going to be attending.
Great. All right. Any questions? All right, Anthem? Anybody from Anthem?
Hey,
This is
Steve.
Dr.
There we go.
This
Go ahead,
is
Dr. Weeks.
Eloise Weeks from Anthem. I'm standing. Oh, you go ahead.
No, Dr. Weeks, go ahead. Feel free.
Oh, I was just gonna say we don't have any updates.
Okay. Again, we understand. We're all waiting to get busy. What about Humana?
Hey, Steve, this is Jeff Hadley with Humana,
Hey, Jeff, how are you?
and we've had one person, one member, I think released for the reentry program in 2004 so far. So we've only got one individual to claim in that regard. Had a lot of activities with our community engagement outreach and other teams, community health worker teams. I've attended several activities directed towards the reentry population. We've been to the Hopkinsville chapter of Western Kentucky Reentry Council each month, the Health Reentry Coalition meetings that are hosted by Kentucky Voices for Health, monthly release classes at the Rotorua Correctional, the Kentucky State Reformatory, and Luther Luckett Correctional Facilities. Done some goodwill events that are directed towards incarcerated individuals or previously incarcerated individuals. The Greater Louisville Reentry Coalition meetings, the Bluegrass Reentry Coalition meetings in Richmond, reentry simulation hosted by WellCare and the Department of Corrections in Frankfurt, Community Impact Council on reentry meetings in Frankfurt, and planning on attending on the 19th an expungement job resource fair in Woodford County, hosted by the Department of Corrections and Division of Reentry Services. So that is what we have going on.
All right, appreciate it. Thank you.
Thank you.
Passport by Molina.
Good morning, everybody. This is Mark Zockham. Some of this might have overlapped a little bit with the January meeting, but so far we have had or been to 10 expungement clinics and 5 pre-release classes so far this year. 20 more are currently being planned. The ones we've done have included some we hosted at our state offices or hosted or co-hosted with offsite partners with Glasgow Housing, Clinton County Community and Technical College. Others we've attended in prisons and local jails, including Warren County Jail, Kentucky Correctional Institute for Women, Butler County Jail. Of the others being planned, there will be 5 more at our state offices in collaboration with DOC and Regional Legal Aid. We are also participating in reentry councils within the state. So all of that was mainly done by our community engagement team. Priscilla's on the call today. We're really proud of everything they've been doing. So far in 2024, they have had 129 engagements around expungement and reentry, including the events, 22 in-person meetings, 26 one-on-ones with members around reentry discussions, 30 phone calls with members or advocates, usually after the expungement clinics, and 24 virtual meetings with councils, planning with DOC, etc. Meanwhile, our case management team is working with our analytics team to identify non-NGA pilot members more quickly post-release, so we can begin offering case management services at a cadence that lines up with what we do with the NGA pilot members. I will say, as far as NGA goes, we did not receive any referrals last month. It's been a little slow this year so far, but that's my report.
What does NGA stand for?
National Governors Association. It's the pilot that DOC started about, pre-pandemic to have fast services for reentry population.
Our whole life is measured in pre and post pandemic, isn't it?
Mine seems to be.
It seems that way, doesn't it? But I was telling people, it's unrelated to this, but 4 years ago yesterday, schools in Lexington shut down for a year. So, all right. United.
Hi, good morning, Steve. It's Stephanie Koenig. So some of the updates, community engagement with the expungement clinics. So we do have field-based care managers that are attending those clinics. In addition, we don't have referrals to report either, similar to the other MCOs, very low in that pilot that we've historically received. We do have concerted efforts on outreach attempts. So this is similar to kind of how Passport was reporting. We have internally tried to bump that up against eligibility files. And so we do have a pilot internally going on for outreach attempts to engage in the HRA to assess their needs and connect them with case management and community resources. So last month, we had identified 316 members that were eligible for that type of outreach. We were able to successfully contact almost 40. So that effort is continuously going on to engage them quicker. So that is a monthly report we're reviewing, and our case management team is attempting to engage them in a different way in which internally we receive referrals for case management. So we're trying to proactively try to identify these members and connect them to case management.
All right. WellCare and Centene.
Good morning. If we're a C, I guess that would put us third in the order instead of the W. But good morning, Steve.
Is that an official request, Stuart?
No.
Next month where you're going to be, right?
I'll think about it. Good morning, Steve. So WellCare, we have what are called community impact councils. This is our community engagement team. And so we have a massive database of social determinants of health needs by county. And we form these different councils that will target certain needs in a given area. And we'll reach out to civic leaders, community leaders, and set up these councils to collaborate, brainstorm to tackle different issues. Well, all this to say, we have one that's in Frankfurt that is addressing persons reentering society from incarceration. And so we had I believe it's the third council meeting that we've had. And part of it, we worked with the Department of Corrections, who put on a reentry simulation event. And it was a couple of weeks ago, maybe late February, in Frankfurt at the library there. And it's a really good experience because you're handed like it's a laminated card with 4 weeks, and the scenario is you've just been released from prison. I mean, just been released. And you got this list of each week, all the stuff you have to do, get urine drug screen, get food, pay, child support, perhaps, go to Alcoholics Anonymous meeting. Everybody has like their unique circumstance. Like mine was 10-year convicted felon for armed robbery with substance use disorder. So all around the room are people who represent all the different agencies where you've got to go get stuff done, including the bank as well. And you've got 5 minutes the way they do it. So you're standing in line, you're trying to figure out, okay, I got to get this, got to get this. And it's really eye-opening, I guess, because you're sitting there thinking, oh boy, and you get kind of overwhelmed, and then you can get rejected, like you do the urine drug screen, and they flip over if you're positive or negative, and so I failed, and so you're back in prison. And then at the end of the 4 week, each week is like a 5-minute session. At the end, you have to go to your probation officer and looks at, oh, okay, well, you failed 2 drug tests, you didn't do this, because sometimes you just couldn't get it all done. So anyway, I know, people participate in those events, but anyway, really appreciate the Department of Corrections. And so then afterward, we had the council meeting, which is to collaborate. And really want to thank Lana of Aetna, who was there. Also had someone from Humana who's part of this council. So we really appreciate that partnership. And so what we talked about is if you're in the state system, you are given essentially resource, because that was the thing. Okay, this is what it's like for us. You're literally walking out the door and you got to get the stuff done. What's told to somebody when they're being discharged. And so they are individuals from a state penal system are given something. They are given like resources, basically a 2-pager with all these different contacts, community resources to help them. But if you're in like a local jail scenario, and a lot of times that's short, very short duration, you're not given anything. And so actually Lana of Aetna is one that came up with the idea. She talked about, well, everybody has to go to a pre-trial hearing and talk to a pre-trial officer. And so it would be critical. It'd be nice if we could do the same thing, have a resource to hand out there at the pre-trial hearing. So anyway, and we're gonna continue. We're gonna have more council meetings. But anyway, that was really neat. It was about 3 weeks ago. And then also, Paula McFall, I think, has an update from WellCare/Centene.
Hi, this is Paula. Can you hear me?
Yes.
Yes.
Okay. Yeah, we work, I think we've mentioned this before, we work with an organization called Waysprings. They're a partner of us, and they are meeting people in the community. And so they are working towards meeting with several correctional facilities to assist in transition into society. They have met with Blackburn Correctional Complex, Jeremiah Prater, Boyle, about county jailers. So they are in the process of finalizing, working with the Luther Luckett and KCIW Bell County Forestry Camp, and several drug courts. So more to come on some outcomes related to that, but we are definitely trying to meet members prior to release if possible, to assist in their transition into the community.
Right. Very good. Any questions? I see Christian Porter joined us. So we're now up to 5, not enough.
I believe Kevin also hopped on. I thought I saw him logging in.
Oh. Does that get us to 6? Hey, Kristen, how are you?
It should. I see.
Good morning, everybody. I've enjoyed hearing about all of the feedback on the reentry simulation and all of the events that are going on. So I know that our staff really enjoy hearing about those. And sorry, I was just a few minutes late this morning, so happy to be here.
I see Kevin on.
Yes, I'm on.
All right. Can we go back and then take action on the minutes? Entertain a
Absolutely,
motion.
as long as everybody is on camera who's voting.
All right, Kevin, on camera, buddy. Can I have a motion to adopt the minutes?
I'll make a motion.
Make a motion.
You?
This is
And a
Brandon
second?
Harley, I second.
All right, very good. All in favor, signal saying aye.
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 And opposed. Adopted. All right, I can report that at the MAC meeting now. We had a quorum. I always add future agenda items. Try that again. No future agenda items. Very good. And no recommendations. We just appreciate the good work Medicaid's doing with our partners at CMS. And I've only heard wonderful things about the reentry simulations. That everyone thinks it's really profound, that so much has to be done for folks who, you know, kind of here, go forth and do good. And that has to be concerns and barriers and frustrations for those folks. And the better we can do in that process, you know, we can really accomplish the objective of just, you know, reentry should be a single event in a person's life, in my opinion, and we can get to that place. We're all in a good spot. So appreciate that. My daughter's done one. She asked me, "Is there any more?" Because she wants to do another one. I mean, she did one in college, and she wants to go.
Yeah, absolutely. Well, and I'll tell you, we host them all the time, and some of them are open to the public, and then some of them we host privately. So if you go to the Kentucky Department of Corrections website, click on the Division of Reentry Services tab, there is an events tab, and it will list on there the ones that we are hosting. And if it's not open to the public, then we'll put on there, you know, that it's not open or whatever. But if you want to attend, all you do is email the person that's hosting it and let them know. So that way they've got the number of people that are coming. So if there are people that want to attend, you can go on there and kind of look and review.
Okay. That'd be good. All right.
Hey, can I
Hey,
speak to something really
yeah.
quickly? I think somebody mentioned something about, I heard pretrial there, and we would love to be involved in some of your local processes. I think that was the Frankfurt community one. The only thing, and let me say this, is that at the pretrial hearing, pretrial service specialists are not there. They're typically at arraignments because the main purpose of pretrial is to get you out of jail. So if we see you again and you're on monitor conditioned release, we'd certainly be open to handing out the resource guides, and we're always looking for resources that we can hand to our clients during those meetings. So, but I'd love to be a part of those meetings, or at least have my local regional people as part of those meetings so we can brainstorm and see how we can assist. Because I think one of the things that we're trying to implement, and hopefully we can get a partnership with the jail on this, is like giving people just the number to Medicaid or the number to re-enroll when they're released from custody, because we think that's important. So we're trying to do as much as we can to help those people that are released, even from the local jails.
That is awesome, Angela. Are you with who are you with?
I am the head of pretrial services.
Okay. Would you
AOC, right?
Okay.
Yeah, AOC, yeah.
Would you, I'll put my email in the chat. Is yours,
Okay.
I guess, angela.darcy@ky.gov, or?
It's angeladarcy@kycourts.net.
Okay, all right.
I'll put mine in there too.
Okay, thank you. Greatly appreciate that. We'd love to have you participate.
And I will offer to participate as well, because we at UK have this robust program where we assist with re-entry with our county jails, state prisoners housed in county jails. We have lots of resources to offer for treatment for both HIV and for Hep C. And as we know, that is a very, very prominent problem that they come out with. And there are so many competing priorities, as you all have stated. And this is absolutely great. And if we can provide those resources where they can have a contact when they're ready for that, because there are other priorities, where they're living, where their food's coming from, how they get that bank account, those things, as you know. And we are seeing an uptake 6 and 7 months after release where they're wanting to address that. And if we can provide that information at that reentry point, by all means, we're willing to participate as well.
Awesome. Thank you. Thank
Good.
you. Would you put your email in the chat as well?
Absolutely.
Thank you. Greatly appreciate it.
Anybody else?
If I could just have 1 minute, Steve, I
Yeah,
wanted to
yeah,
let
sure.
everyone know, all 4 legal aids now have their Project Renew programs up and running. So all the legal aids now have at least one attorney dedicated doing the work like I do, which is helping people in reentry and recovery address civil legal needs. But that also includes expungements. So if you guys, you have members who you come across or your workers come across saying that they need something, feel free to reach out to whatever legal aid is in that area. If you need a map or you need guidance on which one it is, whether it's Apple Red, Kentucky Legal Aid, whatever it is, you can reach out to me. Or there's a map on, I think it's on AOC's site as well as the bar's website, but I'm happy to help as well. But I just wanted to make sure everyone knew that officially they all have a Project Renew now, and we actually convened last month to get together to share ideas about what everyone's doing. But the basic concept is the same. The goal is to, help people in their reentry and keep them from going back or keep them from relapsing.
Pretty good. Thanks for that, Casey. Other updates? Kind of skipped that on the agenda, my bad, but y'all covered it. Anything else? And in the chat, everyone got the emails that are listed in the chat? All right, folks, if we are done, we can finish and see y'all next May 9th. We'll be counting our Derby winnings. We won't be.
Thank you all.
See y'all.
Have a great
Thanks,
Thursday.
everybody.
Just an update.
Thanks.
Yeah, there's some stuff
Thank
in
you.
the thing. And can you get those things in the comment, Aaron? Maybe send those out.
Yes, I absolutely will. We will get those to you, and also be on the lookout for your new reoccurring Zoom link. Again, I do apologize for all the chaos this morning. Zoom just completely deleted this meeting and the behavioral health meeting for later this afternoon. So fun times.
Tell
Seems
Dr.
like a
Seuss for
Monday.
that. Yep.
Good
Yeah, so
job
Steve?
catching it. Good job
Yeah.
catching it, Aaron. We appreciate it.
Yeah.
Well, I usually log in about 20 minutes early. And for some reason, about 45 minutes before, I said, I'm going to go log in. And it was like, no, invalid link. You can't do this. And I called Kelly